Hello everyone, welcome to the Traumatic Brain Injury and Intimate Partner Violence webinar. Thank you for having us from Manitoba Brain Injury Association come to present to you all. I know I am just a voice right now, but I'm also physically here to answer any questions you guys may have. We just decided a cute little video might be a bit more fun to present. Right now, I will show you guys a little video I had made a couple months ago to explain a little bit about what we do at Manitoba Brain Injury Association.
I'm Sierra. I'm the program coordinator for Manitoba Brain Injury Association. Here we provide support services and support groups, as well as advocacy services for those with brain injuries and their friends and family, as well as their caregivers. We also do provide educational services, educating the general public in different high schools, medical centers on the prevention of brain injuries and information about brain injuries as well.
It was nice to put a name to a face, even if the video is kind of on the older side. However, enough of me. Here are a few photos to show a little bit about what our organization does for its members. As the program coordinator, I spend a lot of time planning support groups and activities for my clients to enjoy as brain injury survivors. These pictures are just a snapshot, pun intended, of the things we enjoy doing with our clients. We try our best to support our clients, especially knowing all of their backstories and experiences. And while a lot of the time it may be fun and games, we think it's best to educate those unknowing about what having a brain injury is actually like and what they tend to experience on a day-to-day basis. Communication is a complex process, but so important when interacting with someone with a brain injury. It involves not only the ability to produce or understand speech, but also the interpretation and usage of signs, symbols, gestures, body language, and written language to produce or understand an incoming message. While a healthy human brain carries out the steps quickly and without much effort, a person with a brain injury may have one or more of their brain functions needed to carry out the necessary steps impaired, which can make producing or understanding speech or language challenging and frustrating. The way a traumatic brain injury presents itself in a person can vary. However, usually when the frontal and temporal lobes, which are responsible for cognitive and sound processing respectively, are deemed impaired after suffering a TBI, they tend to produce communication difficulties. A common communication disorder affecting brain injury survivors are known as cognitive communication disorders. Problems with cognitive functions include difficulties with attention, thinking, concentration, memory, information processing, reasoning, and problem solving. It has been reported that over 75% of brain injury survivors will experience some form of communication impairment, with the most common being cognitive communication disorders. Problems with cognitive functions include difficulties with writing, reading, listening, speaking, and conversation. Someone with a cognitive communication disorder can be overly talkative or speak very little, be inefficient and go on tangents when communicating or speaking, jump suddenly from one topic to the next, or provide confused or inaccurate accounts. Understanding mental health is so important when working with clients in a social, health, or legal service or setting. Cognitive communication disorders can lead to mental health problems. However, the relationship between that and brain injury can be complex. It can often be difficult to establish whether the symptoms a survivor is experiencing are due to a consequence of pre-existing mental illness, possibly made worse by a brain injury, or a consequence of the brain injury alone. This is partly because symptoms of brain injury and those of some psychiatric disorders overlap, such as fatigue, insomnia, appetite loss, poor concentration, and difficulty taking part in activities. Bottom line, with what we know of all of this, is that people who sustain a brain injury are at an increased risk of experiencing mental illness. You may be wondering how much the consequences of having a brain injury affect the individual, or how they may present itself in terms of mental health problems, if they present itself at all. The answer is that it really depends on the individual. Psychiatric consequences of a brain injury are influenced by how a person was pre-injury, co-occurring disorders, injury-related factors, and pre- or post-injury environmental factors. It has also been found that women tend to fare worse than men when it comes to symptoms of brain injury as well as their mental health. Women with a brain injury tend to report more depression, stress, and anxiety symptoms. While women survivors of IPV commonly experience post-traumatic stress disorder, having a TBI has been reported to increase the risk of post-traumatic stress symptoms. This can make things difficult when supporting an IPV survivor with a brain injury, as the symptom overlap creates for misidentification of brain injury in women survivors, with symptoms of brain injury being mistakenly attributed to PTSD. The co-occurrence of TBI with depression and PTSD has an effect on the recovery process after a brain injury. As well, with the knowledge that women generally fare worse than men after a brain injury, this highlights the importance of addressing specific needs of women survivors of IPV who have sustained a traumatic brain injury and whose mental health and history of injury likely places them at an even greater risk for poor health than women in the general population. Let us look now at some signs and symptoms of having a brain injury. Sleep is one of them. Sleep is one of the major things that a brain injury survivor can struggle with, and while we all may have difficulty getting out of bed in the morning, for brain injury survivors, the task seems almost impossible at times. A brain injury survivor might experience tiredness, irritability, difficulty waking up and starting the day, other impairments becoming worse, or reduced tolerance for things. So how can you, as someone who supports brain injury survivors, help or assist with their sleeping problems after seeing the signs? As someone who supports brain injury survivors, you can help with encouraging rest breaks, encouraging healthy bedtimes and wake times, encouraging tasks to be done at a time where they feel at their best, or make activities shorter and with more achievable goals. Moving on to the signs and symptoms of brain injuries and information processing. This is probably one of the more foundation signs and symptoms and is usually the one people know the most about. However, for the purpose of this webinar, we will still go over it. A brain injury survivor experiencing information processing problems may take longer to complete tasks, take longer to answer questions, have difficulty keeping up with long conversations, have difficulty going to school or holding down a job, and have difficulty following instructions. So how can you, as someone who supports brain injury survivors, help with this? You may help them by allowing extra time to complete tasks, speaking clearly and evenly, presenting information one at a time, do not interrupt or answer for them, and ask to see if they understand. Moving on to attention, the signs and symptoms for attention impairments and brain injury survivors are pretty well known as well. However, it can be difficult at times to understand if it is the brain injury or just the person themselves. While we are encouraged to not assume someone has a brain injury, keep in mind that problems with attention is one of the key factors of having a brain injury, and we should be understanding of that. A survivor experiencing problems with attention might not appear to listen, miss details, struggle to maintain concentration, might be easily distracted, and get bored easily. So how can you support a brain injury survivor with this? Well, the answer is pretty simple. You can help by using short, simple sentences, help shorten activity length, do one activity at a time, help reduce distractions and noise, alternate activities to keep interest, and help check their work. Moving on to memory, another foundational component of problems with brain injury. This can be seen as one of the more frustrating aspects of having a brain injury, and sometimes it can seem to a survivor that no matter what they do, they cannot retain information or remember the smallest things. Severity of problems with memory may vary, but the signs and symptoms are pretty much the same. A survivor may have problems with losing things, be forgetful of details, and have difficulty recalling what was learned. So it is pretty easy to help someone with a brain injury with their memory problems, and this is how you can support them. You may help by encouraging rehearsal of new information, help decide specific places for storage of belongings, and help with reminders and prompts to help with recall. As we move on to the signs and symptoms of problem solving, it is important to note that this can be pretty difficult to navigate if you are a health provider, social service provider, or legal services provider, as the basis of meeting with your client is to solve a problem. With a brain injury survivor as a client, it is important to recognize the signs and symptoms and know how exactly to help a survivor with their problem-solving skills. A survivor might have difficulty working out solutions, difficulty thinking of new ideas, and disordered approaches to problem solving. So as just mentioned, it is important for service providers to understand how exactly they can help with problem solving with their clients, and this is how you do it. You can help by helping them find achievable goals, help clarify the purpose of tasks to solve the problem, and help them to do one task at a time. Now, problems with flexibility is also really important for service providers to understand when working with clients with a brain injury. Flexibility allows someone to amend plans and strategies and think of new ways to do things. Having a brain injury can make being flexible immensely difficult. A survivor may be unable to adapt to change, continue to perform tasks even when they do not work, and are unable to develop new strategies or ways of doing things. This is how you as a service provider can help someone with a brain injury with their flexibility problems. You can help them by helping them recognize signs of frustration in order to stop and refocus, help find different ways to complete tasks, and ask specific questions to help refocus on the task at hand. Moving on to self-monitoring, this can also be seen as self-awareness, something that brain injury survivors tend to lack. Their problems with self-monitoring can sometimes be seen as rude or attention-seeking. However, it is important to note that this is most likely a result of the brain injury and not a result of their character. It is important to be patient when working with a client with self-monitoring issues and knowing what to do when you need to gently lead the survivor toward proper self-monitoring. A survivor may have problems not following the rules, may take over conversations and not allow other people to speak, and may carry on talking even when others are no longer interested. This is how you can help a brain injury survivor with their self-monitoring skills. So you can help by encouraging taking turns in conversation, validate what they are saying and gently lead the conversation away to another topic or person, and reinforce rules. Moving on to signs and symptoms of problems with insight. Having problems with insight is not the most obvious sign or symptom of brain injury and can also be misinterpreted as being rude or purposefully difficult. Service providers should practice patience and understanding when dealing with insight problems, as well as learning how to communicate in a way that has a lesser chance of being misinterpreted or misunderstood. A brain injury survivor might take statements literally, have difficulty relating to other people, have a simplistic or face value understanding of emotions, may exhibit poor judgment and decision making, be unaware of cognitive and physical limitations, and may exhibit a rigid and concrete thinking style. So how can you help someone with their insight problems? You can help brain injury survivors by using simple language and avoiding abstract terms, give examples they can relate to when explaining something, and pointing out short and long-term consequences of decisions. Moving on to signs and symptoms of problems with mood in brain injury survivors. This may not be the most obvious problem that brain injury survivors face, as everyone every day can struggle with their mood sometimes. However, problems with mood can be extremely difficult for brain injury survivors and can be tricky for service providers to understand. Survivors may experience sudden changes in mood and laugh or cry at inappropriate times. Here's how you can help a brain injury survivor with their mood. You can help by identifying triggers for mood swings and explaining the situation at hand and discuss how to read the room. The last sign and symptom of a problem with brain injury that we will discuss is motivation. This is also really important for service providers to understand, as motivation is an important part of the problem-solving process that is usually done when one seeks out support through the usage of service providers. It is not to be seen as being lazy, but rather not understanding how to go about tasks or working towards solution. A survivor may not act on something until prompted, and may not complete tasks that they know how to carry out. So as a service provider, how can you help motivate your brain injury survivor client? As a service provider, you can help give prompts in the early steps of a task, and you can help with rewarding initiative and persistence. So what are brain injury survivors wanting health and legal professionals to know? At MBIA, we have gathered a few viewpoints from some of our clients with brain injuries that have experience in reaching out to service providers for help. Here are a few direct quotes that we have gathered. When I talk to my neurologist, I feel ignored, and when I ask questions, he cuts me off. I try to get things explained to me, and he does not want to. He does not repeat himself. He refuses to repeat things and says I need to have a caregiver with me. He makes me feel horrible and ignored. But when I was with my ex, he was pleasant and would explain things to him. It's when I am alone and try to get things explained that he refuses. He doesn't want me talking at my appointments. It's my health and it's frustrating. Having a meeting with doctors while you have a brain injury is difficult. A lot of the time, I struggle to understand doctors because I zone out a lot when speaking to them, and I have to ask a lot of questions. As someone with a cognitive impairment, it is hard to understand doctors because they talk too fast and sometimes don't explain things in detail. Yes, I have felt ignored and dismissed by a health professional a lot of the time. In the last 15 years, I got no help at all. Doctors don't want to give you the time of day. From what I've experienced, they just send you away most of the time without explaining things properly. Alternatively, we have also asked our clients what can health or legal professionals do to make them feel heard and make their time being there be respected. Here is what our clients had to say. Take their time. In this city, there are way too many people that need medical help, but we do not have enough good doctors that are willing to properly help people. It is better to really work with the patient, listen, and try to understand them. Prior to working at MBIA as a program coordinator and social worker, I had little to no interaction with anyone with a brain injury. After coming to the organization and working directly with clients who have various types and severities of brain injury, I can see that it is definitely not a one-size-fits-for-all. After working with brain injury survivors for over 2 years now, I have found different ways and approaches to working with certain individuals as their brain injuries are not all the same. Some of my clients have perfect speech, while others struggle to say just one sentence. Some of my clients walk with a cane to help with their gait, while others can walk or even run. After seeing how different all of their stories and brain injuries are, the main thing I learned while working as a social worker who supports those with brain injuries is that we should never assume one's story or capacity to do things. I take the time to listen to my clients and observe their speech and language habits so that I know how to better communicate with them. I understand that this is probably just as frustrating to them as it is for the service provider, and that they want to receive help but their brain injury makes it difficult for them to accurately and smoothly voice what they may need. That guy walking into a clinic off the street with a slurred speech and weak gait may not be impaired by alcohol, but rather may have a brain injury. In the case of IPV survivors, as a service provider, you are dealing with two types of clients in one, a brain injury survivor as well as an intimate partner violence survivor. Therefore, it is detrimental to the case at hand that you take the time to understand, be patient, and listen to what they have to say, and offer support when needed with the advice we have outlined in this video. We thank you for listening and watching this video, and if you have any questions, feel free to contact us at community@mbia.ca.